Good morning. If we could have your attention for just a few minutes, we'd appreciate it. We have I have a couple of announcements to make, or a couple of people to introduce you to. I'm the division leader for the health and wellness programs for the nation. You've probably seen me here lots of times, and I've spoken here before. But today I'd like to introduce you to Paula Stabler. A lot of you already know her. She is currently the acting director for the clinic at this time. So if you have any issues or problems or concerns, or just want to say they're doing a great job at the clinic, Paula's the person you need to go to. The next person is our guest speaker, which is Jan Dunn. She is our new licensed clinical social worker. She just started, gosh, what?
Almost 2 months
Two months ago. So she's here and she's working in the clinic, and she's reaching out to a lot of our other departments to try to work with them so that we can get some collaboration going with some of our other departments. And we have two people here from our prevention department too, Daisy and Dana. And they do a lot of work with our suicide prevention. So if Jan wants to go ahead and come on up, I'll let her take the microphone, because I know she has to get back to her busy schedule.
Thank you so much, Manon. Well, thank you guys for sitting here. It sure does smell good. Are you guys enjoying your lunch? Yes, of course. It's so good here. Well, what Manon didn't tell you is that I am married. I have a 6-year-old son and a daughter on the way, and so we're really excited about that. I currently live in Skiatook. How many of you are familiar with Skiatook? Yeah, we're just about 15 minutes down the road. But I grew up there. I was the youngest of 6 kids and lived on about 40 acres. Moved to Tulsa, got my education, swore I'd never move back to Skiatook, and I did about 5 years ago, and home is home is home, and that's the truth. So we're raising our family out there, and our boy is loving it, and I'm sure our daughter will too. Just a little bit about my experience. I've worked, I have my master's degree from OU, and I went through all the training to get licensed clinically to practice social work. I worked at St. Francis for a few years when I first graduated college, and then I went on to nonprofit work. And I worked in adoption and counseling adoptive families, and I did that for 11 years. Now that I've been at the Wah-Zha-Zhi Health Center, it's been amazing. The people that I get to work with, the clients that I'm serving are incredible, and it's amazing. So I'm learning a lot and being able to do a lot of the things that I love. Okay, so who knows what behavioral health is? I've come to the right place then. Good. Well, I'm here to talk about the top 5 reasons why you would come and see me. Because so many people don't even know that I'm there. And I think that it's an important service that the nation provides to us. And I just think that we've got to just take advantage of it when we need it. So, here for the top reason, you know, a lot of people think about behavioral health and they think, well, I don't know if I want to do that, you know, because they think about counseling and therapy and things like that. And the one thing that I say is, well, gosh, how many of you would go to the doctor if you had a broken arm? Would you go to the doctor to get it treated? I would, definitely. I think for me, the heart and the brain are the most important organs that we have. We need those to live. We need those to survive. We can do without a finger, do without a toe. We can do without some of that, but we need our heart and our mind to stay healthy so that we can function. And that's where behavioral health comes in. We've got to treat that because our brain is a complicated thing. Our heart matters, are complicated things, and we want to be able to help you deal with a lot of those things because that's just one of the main things that we want. When we're emotionally happy, our bodies are physically better. There's a lot of studies out there about that, and That's one of the things that we don't want to just address your physical health at the clinic. We want to address your emotional and your heart matters also. Okay, number 2, medications. I have the privilege of working with a psychiatrist who works in Oklahoma City. His name is Dr. Pierce, and he is able to manage medication. And sometimes, especially when we hit some low points or something, how many of you guys have fallen on hard times? I'm gonna think whether there's a lot of stories in this room, there's a lot of things that you guys have been through and walked through and you survived. Sometimes when we're in those dark places, our chemicals in our brain need some oomph, and that's when medication comes in. And Dr. Pierce, I don't do anything with medication, but Dr. Pierce is able to actually manage all of those types of medications to kind of help take that edge off a little bit, help get you kind of where you need to be and where your body needs to be. And so that's another reason why you can come and see me, because the process for that is I'll sit down with you for an hour, and I've got an office all to myself, and I get to ask you a lot of questions about your life. I get to hear about what's going on in your life, and it's an assessment that we do together. And then Dr. Pierce will look at that, meet with you, and then determine what kind of medicine treatment you might need. And so he'll be able to manage that medication for you. So that's number 2 reason. All right. Do you ever sometimes not get listened to? Ever? I love that. I don't get listened to sometimes. I know I've been the one that's in a hurry and doesn't listen to someone else. Well, sometimes we just need a listening ear. Just someone to sit with us. Talk about something that's bugging us. How many of you, when you talk about it, you feel better? I feel better after I talk to someone who's there when I know they're not going to go talk to so-and-so about it, or, I think for me, having a safe place to go talk to someone about my troubles is invaluable. And I know it's not going to go anywhere, because you know what? What is said in that room, in my office, stays in that room. And sometimes we just need that, and we need someone that's, not going to boss us around or tell us what to do, that can just listen and say, oh man, that sounds like, a horrible situation, and help kind of try to I like to walk alongside of you. I'm not there to tell you what to do. I'm there to take your lead, because you've made it through life this far. You know you. And I get to know who you are, and I get to be able to help find that inner strength in you to get through that hard time. So that's number 3, the listening ear. There's going to be a quiz afterwards, by the way. I'm just kidding. Okay, number 4, our feelings, can they get overwhelming sometimes? Have you ever felt more than one thing at one time? It's not just, oh, I woke up and I had a happy day today. Most days, those days are great. There's going to be some days where our feelings can just become too hard to manage on our own, and we need someone to sort it out. Have you ever, when you're talking to a friend or talking to a family member, you can see their problems clear as day, and they can't see them at all? Has that ever happened to you? It's easier when I'm sitting where I sit to see what you might be going through. We sometimes are too far into it because our feelings are taking over. We can't really see what the problem is. We might be looking here or here or here or here and not really getting to the core of it. So that's one thing, that's another reason why I feel like, come on into behavioral health, because I think just to sort that out, that can sometimes just take a few weeks to sort out a problem, and to really identify what feelings you might be having them, why you might be having them, all that good stuff. All right, and then the last one, life happens, doesn't it? Life can just happen. Things that happen that we didn't see coming. It could be an illness. It could be a family crisis that's happening, a car accident. It could be our finances got cut in half. You know, things that just happen. And there's nothing we can do about it, but by golly, we can help handle it successfully. And that's where behavioral health comes in. Helping to manage a lot of that is sometimes all we need. Someone to walk alongside and get things like that sorted out. You know, there's a lot of great folks that work in the Osage Nation, and we all work together to try to get your needs met. And behavioral health is just one of those avenues. Boy, I went through that fast. All right, so just as a reminder, did you get it? Oh, good, that makes me happy. All right, so reason number 1, heart and brain, very important to function. We got to take care of those, and that's what we're here for. Number 2, you might need some medications for those chemicals in our brains getting out of control. You get to come in and see me for that too, and Dr. Pierce. Number 3, a listening ear. That one's a big one. Sometimes we just need someone to sit with us and listen to our troubles. Number 4, our feelings can get overwhelming. Sometimes we just need some talk therapy. Talk therapy takes that edge off, and we just need to talk through it and get a solution going. And then number 5, life happens.
I want to know though, when you get coming up there,
Yeah.
you get the CRA and they tell you they ain't nothing they can do for you.
Oh. So what are you going in there for?
Well, CRA. Can't remember anything.
He got me. He totally got me.
Then I got ADD real bad.
Okay, age? I'm trying to think how I can help you with that. I don't know if I can. That's a good one.
He's been lost for a long time.
Well, okay, but I like the lost and I like the honoring. I like that. Well, do you guys have any questions for me? Otherwise, I'll let you eat your lunch in peace. What do you think? Any questions? Okay, good. Well, and you know what I'll do is I'll leave my direct line at the clinic. I'll leave my direct line somewhere so that if you guys want to just jot it down and give me a call, you can. Okay? Thank you so much for your time. I really appreciate it. Yep. Oh, okay. Did you have a question, sir?
No.
Okay.
I was just thanking you.
Okay. That's good. All right. Thank you again. Thanks.
Okay, I thought I'd make just a couple of announcements. Some things that the flyer. The next Lunch and Learn is going to be on February the 5th, and it's with our new optometrist, Dr. Marshall Walker, and he's very good, very nice, and I'm really anxious for him to come and visit with all of you. The other little announcement I wanted to let you know, there's a lot of changes going on over at the clinic as far as processes and procedures are going. And so if, when you call now, we've got several phones that will answer when you call the clinic. And we've also got some slots for some same-day appointments. So if you do need an acute visit, something urgent right then, got a sore throat or something, we hope to be able to get you in right away. And so I think that's important, and we're wanting to get that out to all the community. We want our patients to be taken care of, and we're a tribal facility now, and it's all about taking care of our people. So spread that word around. We do have same-day appointments now. All right, thank you all very much.